If this happens to you, you need to see an audiologist immediately. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 241, and today I want to talk to you guys about misdiagnosed hearing losses. But before I get into this video, if you could do me a huge favor, click the like button, really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. So I actually have had a number of patients over the course of the past several years who have been misdiagnosed by their doctor for the type of ear condition that they have. Now, if this has ever happened to you, let me know down in the comment section exactly how you were misdiagnosed, what you were misdiagnosed with, and then what the ramifications of that were, because some of these can be pretty bad. So here's the thing. Probably one of the most common things that gets people to go into their urgent care or their primary care doctor is that's ear related, is usually when they have one ear that feels plugged, or they just feel like they woke up and they're not hearing very well. Everyone thinks that it's earwax inside of their ears. So what do? They go into an urgent care, usually not an ER, but sometimes an ER, and other times they end up going to their primary care doctor to have them look in their ear and remove earwax if it's there. And so what these primary care doctors do, or what these local doctors will do, is that they'll look inside the ears and be like, well, I don't really see anything. It's not earwax inside of there. It doesn't look like there's any fluid behind the eardrum, or maybe they do say that it looks like there's fluid behind the eardrum. Go ahead and take this prescription, this antibiotic or something like that, and try that for a couple of weeks. And then if that feeling of fullness doesn't go away, come back and we'll get you referred to somebody else to take care of it. Well, that's great if it was actually like a middle ear infection, or maybe your eustachian tube is inflamed from allergies and stuff like that. The problem is that a lot of these clinics, these urgent cares, and a lot of these primary care doctors, they don't have the ability to properly diagnose what's going on with your ears just by looking inside of your ear canal. You actually have to do something like a hearing test or tympanometry to identify if it's something like a sudden hearing loss, or if it's something like fluid behind the eardrum, or something like that. It's very difficult just to look inside of someone's ears and diagnose what's causing their fullness. And this can be very dangerous, because if you happen to have a sudden sensorineural hearing loss, that means where the hearing just goes away in one of your ears, typically not both ears, but one of your ears, and it happens all of a sudden, hence the name. So people will wake up in the morning, or they'll be driving to work or coming home from work, and all of a sudden it's like, man, what the heck? I can't hear anything in this ear. They get a lot, maybe ringing sound in that ear, but they can't hear actual sound. And basically what's happening is that you're having a viral attack inside of your cochlea that is causing a ton of damage and is causing a massive drop in your hearing, and sometimes it can be something related to something else as well. But the problem here is that if you then go with a sudden sensorineural hearing loss into an urgent care, and they're like, oh, well, here, just take these antibiotics for a couple weeks, and then your hearing, or whatever's going on in your middle ear, like fluid, will go away. And you go home and you do the antibiotics, and it doesn't improve anything, because antibiotics were not the proper treatment for a sudden hearing loss that's giving you that sensation. You actually need to take prednisone, or a steroid, to prevent the viral attack inside of your cochlea from causing permanent damage. And while it sometimes can come back, which is, cross your fingers, let's hope it comes back, the likelihood of it coming back is much better when you receive quick treatment using a steroid. Now, I'm not a medical doctor, I'm an audiologist, so I can't prescribe the steroids myself. The reason why you need to go and see an audiologist is because an audiologist can actually identify if it's a sudden hearing loss, if it's fluid, if there's something else like a puncture or hole in your eardrum, whatever the case may be. We have actual testing that we can do to identify that. Instead of us just looking in the ears and making an educated guess as to what it could be. So you can imagine if you got sent home for 2 weeks taking an antibiotic that you did not need because you had a sudden hearing loss, and instead you could have been taking prednisone or another steroid to help prevent the damage and get your hearing loss to come back, and time is of the essence with these, wouldn't you be pretty upset that you went home, you did the wrong treatment, and now your hearing is gone in that ear forever? I mean, I would be. So that's why it seems like, a lot of audiologists are very cautious when it comes to this thing. If someone calls into our clinic and says, yeah, my hearing, I just woke up and my hearing was gone in my left ear, we literally will let them come in over lunch, we'll have them come in early, we'll have them come in at the end of the day, just so we can make sure that we diagnose properly what's going on with their ear. Because if it's a sudden hearing loss, you want to make sure that you get that identified correctly, so then you can go and take the proper treatment, okay? So, and again, I've had this happen a number of times. I cannot tell you how many patients have come in saying, yeah, I had a sudden hearing loss. I felt like it was earwax. I went into the urgent care. They looked in my ear. They didn't see anything. They said, well, maybe it's fluid or something behind your eardrum. They send you home with an antibiotic, and then it's too late. The damage is permanent at that point when you go several weeks to several months with your ear being, with the hearing loss being down in that ear. You really have to get in to see an audiologist. And even if you go to an ear, nose, and throat specialist, the ear, nose, and throat specialist, guess who they'll have you see first? They'll have you see the audiologist, because an ear, nose, and throat specialist knows that they can't properly diagnose a sudden loss or a ear fullness without proper testing from an audiologist. So that is my word of advice for you. If you have ear fullness, if you feel plugged in one ear, if you wake up in the morning and your hearing is gone in one ear, or you just, throughout the day your hearing just goes all of a sudden, you need to find an audiologist to get them to test your hearing, preferably same day. Call around to different clinics until you find one that will let you in. If you tell them that you've had a sudden hearing loss, 9 times out of 10, that clinic is going to rearrange their schedule so you can at least come in and get a proper hearing test and tympanometry to identify what's actually causing it. And if it happens to be earwax, the audiologist can remove the earwax. If it happens to be fluid, they can send you into your primary care to get that taken care of, or they can send you to an ENT to get that taken care of. But the first step, anytime something goes wrong with your ears, is to contact an audiologist. That is all that I have to share with you guys today. Just remember, something goes on with your ears, who do you call? Let me know if you understood down in the comment section, and as always, I'll see you next time.